And I have a 2:30 meeting with Senator Heidi Gansert that accidentally got scheduled for today. So I will be leaving at that point if we are not done with our business and leave the meeting to Dr. Novak, my vice chair. So this is the Washoe County District Board of Health meeting. It's Thursday, December 14th. And the first item of business, Madam Clerk, is a roll call and determination of quorum.
Thank you. Chair Jung.
Present.
Dr. Novak.
Present.
Oscar Delgado.
Here.
Dr. Hess.
Here.
Christopher Brown. Dare.
Present.
Sorry. Michael Brown.
Here.
Tom Young. We don't have Mr. Young, and we have a quorum.
Thank you very much.
Yeah, he's here.
There he is. Yay. Okay, Mr. Young, would you please lead us in the Pledge of Allegiance?
Absolutely. We'll all stand and pledge allegiance to our flag. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mr. Young. Item 3 is public comment. Do we have public comment cards? Thank you, Madam Clerk. Our first public speaker is Tom Clark, and he is representing Picnic Pub and Patio.
Thank you, Madam Chair, members of the board. For the record, my name is Tom Clark. I'm here on behalf of Picnic Pub and Patio. Those of you that made it to the last meeting heard my initial remarks, and that was there was a cease and desist that was placed against the picnic for their outdoor operations as far as people being able to bring in food that they can then prepare, cook, and consume within their own party. Since that time, I'm happy to say that we have worked very diligently with the district health staff, almost daily, I think, throughout this process. And we're proceeding, going ahead quite well, I believe. I want to give the staff a lot of credit because what we've learned is that we've embarked on a whole new way of consumers being able to have the experience of a restaurant, but being able to bring in their own food, consume it, cook it, and prepare it. It's basically been found that Washoe County is the first ones under the way we're doing it that will allow this type of consumer experience in the country. I couldn't find a single health department in this entire country that would allow people to bring in their own food, prepare it, cook it, and consume it. So, you know, we're breaking new ground. That's what we tend to do in Nevada, and especially here in Reno. So the process that we're in right now, there's an advisory board, a food preparation advisory board, and that board meets to discuss variances and appeals and things of that nature. We were supposed to have this resolved last Thursday, and unfortunately the advisory board didn't have a quorum. So you have an agenda item on your agenda today to approve, I believe it's 3 new members to that board. If that is accomplished today, then we hopefully would have a new advisory board meeting next Wednesday and be able to proceed. At this time, I think that we are firmly in agreement between the staff and with Picnic as to how we can go forward. One of the sticky parts was the definition of approved food. And so in the permitting process, and just to be clear, Picnic has to apply for a new permit, an outdoor food establishment. And then the advisory board will decide on a variance that will thus allow people to bring in their own food and consume it. So hopefully we can get this resolved. That one issue that we had was on the approved food. Consumers will be able to bring their own food, but it needs to be in original packaging and have a receipt to demonstrate that it's a commercially purchased product that they're then going to prepare and consume. We've got an operations plan that's been worked on. We had a meeting yesterday with staff to go through the other elements of that operations plan. I think we're all on board with how that would work. And then it will be up to my client Picnic and the staff to work in the future to ensure that the safeguards that we put in, because, you know, consumer health, the public's health is our #1 priority as well as your staff's. We know that we put forth guidelines and rules that will do just that, keep the public safe. So thank you very much for your time, Madam Chair.
Thank you, Mr. Clark. Are there any additional public comment or people wishing to speak at this point? All right, we'll close public comment and come back to the board for the approval of today's agenda.
Make a motion to approve.
Second.
I I have a motion by Brown, second by Novak. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Any opposed? That motion carries unanimously. Mr. District Health Officer, we have recognitions.
Thank you, Madam Chair. I want to begin with the years of service recognitions, and typically we don't do recognitions for intermittent hourly employees at the Health District, but we had a couple of employees that we wanted to recognize this month because of the exceptional number of years of service that they've provided for the Health District between their careers and intermittent hourly after PERS retirement. So I wanted to recognize years of service for John Fuller, who has a total has, and if you could please stand up, Mr. Fuller, 40 years and 10 months of service with the Health District. He actually started at the Health District 42 years ago, but he had a little bit of time off as a retiree before he came back to work intermittent hourly. Judah Somm, who I don't believe is here today, but a total of 28 years and 6 months with the Health District. And I know that Mr. McNinch wants to say a few words, so I'll ask him to do that.
Thank you, Kevin. Dave McNinch, for the record, I'm a supervisor in the Environmental Health Services Division. Madam Chair, board members, I just wanted to take a real quick second. John, come here real quick. It goes way beyond, John's a real modest person, so is Judith. I wish she was here, but we'll take care of that later. And John, as you can see, loves to be the center of attention. But, I wanted you to know how much we appreciate everything you've done for us. John worked for us for a 30-year career, and then came back around and did some more work and variety of programs, and we don't have time to go over all the accomplishments, but I'll just simply say this: John's moved the dial when it comes to public health in our community, and he's well respected, and started in the mid-70s, and he's been a mentor to a lot of us, even those of us who are getting close to retirement age ourselves, or retirement. So John, I just wanted to say thank you and appreciate everything that you've done for us, and this is a very small token of our appreciation, and I hope you enjoy it. So, thank you, David.
Chairman, I have one thing about this too, and just my brewery started in 1993, and it was the oldest brewery in the state. And at that time, for the health department, it was difficult to regulate things, again, like the picnic things when you're breaking new ground. And I said, John was so helpful back then, and I have to thank you again for helping us get a brewery off the ground quite a few years ago. So thanks for your service. Thank you.
That's great. Thank you, Mr. Young, and thank you. Mr. Fuller, please don't leave, though, because at the end of all of our recognitions, we do photos with the whole group, okay? Thank you, Mr. Fuller.
And I want to see the comparison between his first day on the job photo. All right. Next, I want to recognize Angela Tibiduiza for 25 years of service. Angela, if you could please stand up. 25 years of service with WIC, where she is a human support specialist too. And I'd like to actually mix together our retirement announcements also, because as people get to these lengthy years of service, sometimes the retirements coincide. And so Angela is retiring from the Health District, and we do have a clock for you, Angela, a small token of our appreciation. Washoe County Health District recognizes Angela Tibiduiza for 25 years of dedicated service, December 28th, 1992 to December 14th of 2017. And so stick around and we'll present you with a clock and get a picture in a few minutes. Also, I wanted to recognize Kelly Goatley Seals. And Ms. Seals, if you could please stand up for 15 years of service, a great champion for our chronic disease program. So, thank you, Kelly. And Mr. David Gamble, please stand up. Mr. Gamble's been with us for 5 years now, and he's our MRC Medical Reserve Corps coordinator for our preparedness planning program. So. And then I did introduce Chad Westham to the board during the workshop on November 2nd. Go ahead and stand up, Chad. We wanted to have him on the recognitions here today so that our audience that may be viewing the meeting remotely has an opportunity to meet Mr. Westham, who comes to us from the State Division of Public and Behavioral Health, where he was serving as a bureau chief there, our new AHS division director, and this also provides an opportunity for Mr. Westham to get his picture taken with the board, so we can do the before and after on him later. Should we do our proclamation?
Oh, sure. You're right.
First, and so then next I'll move to item 6, which is our proclamation for Radon Action Month, and I think I'll move to the podium to read this. And Susan Howe is here to accept this from Cooperative Extension.
Great. Hi, Ms. Howe.
If you'd like to stand and join me. Whereas many Washoe County residents don't know about radon, yet need to know for the safety and health of their families, as radon is a colorless, odorless, naturally occurring radioactive gas that is the primary cause of lung cancer among non-smokers, the second leading cause of lung cancer in smokers. And whereas the U.S. EPA estimates 21,000 people in the U.S. die each year from lung cancer caused by indoor radiation or radon exposure, and lung and bronchus cancer kill more people in a year than any other cancer. And whereas radon kills more people than secondhand smoke, drunk driving, choking, drowning, or home fires, and whereas any home in Washoe County may have elevated levels of radon, even if neighboring homes do not, and living in a home with an average radon level of 4 picocuries per liter of air poses a similar risk to developing lung cancer as smoking half a pack of cigarettes a day, and whereas testing is the only way to know if a home has an elevated radon level, and testing is easy and inexpensive, and when identified, homes can be fixed. And whereas the University of Nevada Cooperative Extension, the Nevada Division of Public and Behavioral Health, and the U.S. Environmental Protection Agency support efforts to encourage all Washoe County residents to test their homes for radon, mitigate elevated levels of radon, and have new homes built with radon-reducing materials and features. Now, therefore, the Washoe County Health District does hereby proclaim January 2018, as National Radon Action Month in Washoe County, adopted this 14th day of December 2017 by Kitty Jung, Chair. I believe that Ms. Howe has some comments to make. I don't know if we want to wait and do the vote for this at the end, or?
Go ahead and make your comments.
Thank you. And for the record, Susan Howe, University of Nevada Cooperative Extension. Thank you again for presenting this Radon Action Month proclamation. This is the 5th year that you have given us a proclamation and shown your support for our service to the area. It's especially important for all the reasons that were in the proclamation. And testing is especially important in Washoe County, where 21% of the homes that have been tested have shown radon levels at the EPA action level of 4 picocuries or above. More than 11,500 Washoe County homes have been tested. This represents only 6% of all the housing units in the county. So we have a long way to go. From the valid test results, almost 2,000 of those homes have found elevated levels of radon. And of the homes needing mitigation, 29% have been fixed. So as of September 30th, there was also reported over 1,200 homes tested during a real estate transaction and over 100 homes built with radon-resistant new construction. In zip code 89412, that's Gerlach,
2/3 of the homes had elevated levels of radon. And it's followed by Verdi at 44% and Washoe Valley at 41%. Incline Village and Crystal Bay follow at 35 and 34%. And in Reno, 89501, 89533, and 89570 are at 46% or higher. The highest radon level in the state was found in Reno in 89509, about 3 years ago during our test kit promotion. Because testing is the only way to determine a radon level in a home, Cooperative Extension is giving free radon test kits in the month of January and February. And this is a savings of $10 a test kit, so I hope that more people take advantage of it. It's especially important because this year we're charging $4 test kit for shipping because we paid over $3,000 in shipping out test kits last year. Residents can get a test kit at the Washoe County Cooperative Extension, Sun Valley GID, and they're participating again, and the Incline Village Recreation Center. They can also pick up a kit at one of our 4 presentations upcoming. We're giving a presentation at Verdi Community Library, and that's the first time we're doing that. South Valley's Library, Incline Village Public Works, and Northwest Reno Library. And I've left a flyer of all the dates here on the table. And I'd like to finally tell you about one important thing that's coming up in 2018 that I hope you can support. The International Building Code for 2018 and the International Residential Codes are going to be voted on in 2018. It's probably going to come up for public comment, and I don't know if your district would have a part in that, but I was invited to be on the International Residential Code Committee, and so my part is in support of all the codes changes, but mostly Appendix F of the International Residential Code is about radon control methods in new homes. And of course I advocate for that, for the prevention of lung cancer for everyone. So I just wanted to let you know about that. And I do have some kits with me if anybody wants to come and get kits. Also, for information, we have a hotline. It's 1-888-RADON-10, and our website is radonnv.com. Thank you.
Great job. Thank you, Ms. Howe. And I will ask further on in the agenda, you don't need to wait and see, and I'll even ask right here that we do draft a letter in support that I can sign on behalf of the Board of Health for the code changes nationally. Thank you.
Thank you. Each jurisdiction has to vote on that separately from the building codes.
Okay.
And so Reno will be voting, Sparks will be voting, and the county.
So we'll send it to all 3. Thank you. At this point, we do need a motion to accept this proclamation.
So moved.
Second.
I have a motion by Novak, a second by Dare. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Any opposed? That motion carries unanimously, and now it's photo time. Sure, let's go backwards. Yeah. Oh, thank you, sir. These guys don't take care of me or
Yeah, that's it. It's under $1,000. That's a home that's existing. It costs up to $25.
Oh, yeah, right there. Perfect. Thank you. No, you're fine. No. I just wanted to not have members.
We just offset. Make sure the time's on the end.
Welcome aboard. Thank you. Can I switch with Angela? Yes. Oh, yeah. Wait a minute, you don't want to do a selfie? I thought about it, the camera's kind of big. Your selfie stick?
Just push the button.
Kind of have to hold it down.
Do you want your certificate?
Yeah.
Make sure it says 15 years, because my eyes aren't.
All right, on three. 1, 2, 3.
No flash.
1, 2, 3. You want to check it? See. So that looks okay. Oh, really? Oh.
We have our own flash going on. In a good way. Sure.
Here's overrated.
Congratulations. 5. Wait, one more. 2 each. Recycling.
So Michael could, yeah. Roll on it.
Thank you. What's that? Is that Latino? Yeah. Spanish, yes. I'll hold her rock and she holds.
And I also have a 25-year pin for you.
Congratulations and thank you for your service. That's it?
I thought you meant all the loot.
Does he have a certificate?
I'll just go like this.
West side. West side. Thank you so much for your service.
Sorry about the tight.
Before we wrap this up, I also just wanted to mention that Mr. Fuller was responsible for winning the National Wastewise. Mr. Fuller was responsible for winning the National Wastewise Award for Washoe County
Which means?
during his career for the waste reduction efforts, waste reduction and recycling program that the county established. So I think that was a major accomplishment. I wanted to make sure that we recognize that.
Thank you. Just a little bit back in history, Washoe County joined the Wastewise program with the EPA. There was 150 local governments, and we were number 1 3 years in a row. So
Wow.
staff did a good job.
Yeah,
Good.
you too. Thank you. that brings us to item number 7, consent. Does anybody have any items they'd like to pull out for further review? Seeing none, I would entertain a motion.
So moved.
A motion by Novak, second by Brown. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Item 8, a presentation by Kara Mays on the Washoe County Health District Board Scholarship recipients. Miss Mays.
And Laura, I'm sorry to ask, are you gonna click through it for me?
Yes, I will do that
Is
for
that
you.
mic? Okay, perfect, thank you.
Is that mic on?
Is the mic on, Laura?
It should be. The gentleman checked it earlier, and it seems to be
Yeah.
registered.
I see a light.
It's
Okay.
registered.
I'll just talk loudly.
Talk loud, please.
Okay. Good afternoon, board members. My name is Kara Mays, and I'm the Assistant Director of Development and Alumni Relations for the School of Community Health Sciences at the University of Nevada, Reno. I have the pleasure of working with Dr. Trudy Larson and Mr. Kevin Dick, who is on our Community Advisory Board. It's a pleasure to be here with you all this afternoon. Okay, so I thought I'd start with a brief overview of what I'm here to talk about today. First, I'll update you, and I'll go through all of this pretty quickly. But first, I'll update you on the school's most recent progress and news. There's a lot going on just a couple miles away, so it's exciting to get to share that with you today. And second, I'd like to visit with you about your scholarship endowment at the school and how it's growing and making a difference for our students. This year's scholarship award recipients, Allison and Larissa, I combined their two names, were kind enough to join us here today. They're in the back, and towards the end of my presentation, they'll come up and express their thanks and give you an opportunity to meet them. Okay, so to start on my update of the school, Dr. Trudy Larson, who many of you probably know, is now the dean of our school. She has been the school's director for the past 60 years, and her new role as the dean is a great big move in the right direction for the school and for her. Please know she sends her regards. The school became independent of the Division of Health Sciences in July of this year, and that's what created her dean role, and also will translate to heightened research opportunities for us and a stronger national presence. So we're really excited for the new opportunities available. Okay, the CEF accreditation, the reason why I have this up here today, our MPH programs were CEF accredited in 2011, and there's a lot I could tell you about that today, but the reason it's up here is to tell you that one of Dr. Larson's big priorities for the upcoming 2 years is to become a fully accredited School of Public Health by the year of 2020. Our application is in, and we'll keep you posted on that progress. The third notable highlight from this school is our growth. As you can see here, we have a staggering undergraduate enrollment of 2,565 students. Our total enrollment nearly captures 10% of the university's entire student body enrollment. Okay, our growth to 2,565 students seemingly happened overnight. You can see we nearly tripled in the last couple of years. And part of that is due to our merger with the Substance Abuse Technology Center on campus, the inclusion of pre-nursing students, and also just the health field that's growing so much and students are being attracted to our program. Okay, in our academic programs, you can see an array of our offerings here, and the new one is the MPH online program. I think we're finishing up our first year of enrollment, and we're seeing a lot of people from Nevada. We have a few from out of state, but it's been a great option for working professionals and kind of giving them some flexibility with their full-time jobs. Okay, a key piece of graduating 2,565 students who are prepared to enter the workforce is partnering with local internship sites. So each student has to complete an internship prior to graduation, and we are grateful to the 133 partnering sites in northern Nevada, where more than 37,000 hours of service to the community was completed last year. So here's an example of a student. Her name is Sarah. She's a second-year MPH student who completed an internship. And the really great thing about internships with these folks in the community is that upon graduation, it's gainful employment for them. They usually will end up working where they do their internship. So that's just an example for you to see. Not only do we educate students enrolled in UNR, but we also provide continuing education and professional development opportunities. The Nevada Public Health Training Center is our ongoing effort to provide those opportunities to our workforce. The center trains public health professionals to be proficient in all areas of public health and community wellness, with the goal of constantly improving our public health workforce. And at the end of the presentation, I have contact information and can provide more information about that. We're really excited about those resources that we can offer. Okay, our health needs. When we talk about ways we're offering continuing education and building our workforce, it's all with the inherent goal of addressing Nevada's health issues on many fronts. The School of Community Health Sciences, with its broad curriculum, provides health-savvy graduates who can become our next leaders. Knowing this, we ask ourselves, well, what's our path going forward? And on this slide, you see Dr. Larson's focus and what she sees on the school's horizon. In particular, the last part of my talk today, you see on here internship sites, research partnerships and contracted services, community participation, undergraduate and graduate scholarships, and that's what I'm here to talk to you about today. And so that leads me to your scholarship. We thank you for being a part of our path forward in many ways, including this scholarship endowment, which was created in 2007, 10 years ago. Thank you for your support. Your scholarship was created to support a public health student from Nevada or adjoining Northern California counties with career aspirations in Nevada. With me today are Larissa and Allison, this year's scholarship recipients, who have come to express their appreciation for your support. And I thought I would ask them to come up and you can meet them, and then I'll jump back up to conclude.
Hi, my name is Allison Updike, and I was one of the recipients for this scholarship. I'm from Reno, and I just recently graduated for public health, my bachelor's degree. I'll officially be done in a few days. But I just wanted to express my thanks for your support in my education. It has really helped a lot and made me motivated to complete my education. Thank you.
She just graduated on December 9th, so five days ago.
Where did you intern? Where was your internship at?
It was for a local nonprofit called On Common Ground that focuses on providing nutritious food for people in low-income areas and food desert areas. And,
Terrific, that's great. Go ahead.
Hi, board. I'm Larissa White. I'm a doctoral student at UNR in epidemiology. Currently, my research focus is in delayed diagnosis of pancreatic and lung cancer, and health services, really trying to see how we can, well, get people diagnosed faster so they have, better chances of treatment and survival. I also got my MPH here as well in epi. My internship was at the state in chronic disease. At the time, I actually worked on our HIV and chronic disease comorbidities project. Worked directly with Northern Nevada Hopes, like Trudy, who has a lot to do with Hope, as you guys know. And even though I've expanded from just Nevada and looking at national data now, it is really important, and we're all very grateful that you guys support us in this state where there isn't a lot of funding for us, and it's really great that we have the opportunity to do what we do and shine, especially as we're a growing program and, well, school in general. I mean, it's huge now. I'm first cohort, so we're like the, gerbils, hamsters, if you will, for them to see how they do the PhD program. So I'm giving them a lot of feedback and making sure it goes as smoothly as possible. So thank you for your support. We both really appreciate it.
Thank you, and thank you for being here. Congratulations.
Okay. Thank you, Allison and Larissa. So on the next slide. So I'm pleased to report the continued growth of your scholarship which now has a market value of a little more than $18,000 and is estimated to award an $800 scholarship next year. And I brought the endowment report with me, hot off the press, and I think that's somewhere for your review afterwards if you're interested. And what I would like to ask you to consider today, a fully endowed scholarship at the university is $25,000 for a $1,000 award each year. And so I would like to ask for your consideration of a gift to grow this fund to that level and continue supporting our students in such a meaningful way. And I will send some follow-up information so you can consider that at your leisure. Okay. And finally, I welcome any questions you might have, either now or at another time. And also thank you just so much for the opportunity to be here with you today. Contact information is up there, and I'm sure Mr. Dick can point you in my direction. Thank you again for your time, and happy holidays.
Thank you, Ms. Mays. Hang on a second, because there might be some questions. I'll start down here. Mr. Young, Dr. Hess. Mr. Young, go ahead.
Oh, no, I was curious. I'm always a real fan of education, also including some real-life experiences and things, too, with internships and actually kind of making all the education real. But are these students, do they apply for these, or how are they selected? Is there a competition to get certain internships, or?
You know, that's a great question. I would love to defer. Allison or Larissa, can you speak to that process a little bit more? I think there is some sort of partnering.
Oh, sure, you know, we can brewing science here, and you know,
Sign me
up. Usually, at least in the MPH program, they're kind of given a list. And we have this list, and of course everyone wants to get the coolest internship that sounds really amazing or interesting. Some people go out of the country, but I mean, you have to pay, obviously, to do that. No, you do interview for these positions, just like you would in any job. You go for the interview, they consider your current and past work history and also your interests, and if you're a good fit for that particular agency or nonprofit, whatever it may be. So. Not so much a competition, but just like in real life, like getting a job. And a lot of students actually continue their work with those agencies after the internship ends. They'll get offered like a contractual position, which is great for them. Yeah, definitely.
You might want to stay up here in case we get another hard one.
Well, anyway, yeah, it's a wonderful program, and I appreciate it.
Are you on the list, Mr. Young?
Well, no, I'm going. I don't know exactly whether we could fit into this.
You could.
Okay, we're in. We're in.
Okay, wonderful.
Anybody else have any other questions, or Councilman Garrett?
I have one question, just with what we have going on in our area. How do we keep you guys here once you graduate? Because we need you to stay in the Reno, Sparks, Washoe County areas. And so, I mean, and I know we say that a little tongue-in-cheek, but not actually. We very seriously do need to keep you guys around. What are some of those things that might help make sure we have the medical field we need?
I mean, of course, that's a large question that has a lot of intricate components, but I think mainly organization. You know, when I was at the state, there's a high turnover rate for a lot of positions there. Things are changing constantly. People leave to what they consider to be better jobs, whether that's due to pay or whether that's really due to, like I said, organization. The ability for these programs and everyone to get together and actually create real results in the community. And as you know, in any bureaucratic situation, there's a lot of red tape and things occur that they can't really do what they want to do. But that's why we always recognize those people that get stuff done regardless, right? So I would just say infrastructure, really, like I said, organization, infrastructure, and more opportunities for them to directly apply their skills in the community instead of always just being at a desk. I think a lot of people in public health, they get tired of that. They want to really see the change in people when they're doing something. They want to be out there in the community. So yeah, that would be my answer.
Thank you. Any other questions? Thank you very much, Ms. Mays, and we appreciate. And so, the endowment, would that have to be forever? You put money in it, or to get it up to the 25, that'd be $7,000 more dollars.
Exactly.
It's just a one-time fee.
It's a one-time gift, and the beauty of an endowment is that it continues to grow in perpetuity. And
right.
Once it get, the funds are there now, and they'll continue to grow, and eventually they will get to that 25. So I don't want to be misleading, but it would just happen more quickly. And once it's there, that principal amount is not touched, and it's the
just the
interest.
So there's 7 of us here, guys, so that's just $1,000 each if we want to put our money where our mouths are when it comes to public health.
Well,
Just a thought.
thank you for considering it, and I'll follow up with that information
do.
as you decide.
I appreciate it. Thank you, Ms. Hayes.
Thank you. Happy holidays.
Happy holidays. Item number 9, a presentation for the Eddy House with Michelle Gare. Hi.
Are you changing the slides? Okay, I just want to make sure I don't have to do anything. They don't even trust me with the email at the office. So. My name is Michelle Gear. I am the Executive Director of Eddy House. And we are located at 423 East 6th Street between Record and Valley, so right downtown. We are the central intake and assessment facility for all homeless youth in Northern Nevada. We serve primarily non-system youth. That means that these kids are not affiliated or connected with any other organization, agency, or any kind of other nonprofit. These are street kids, essentially. So I had to update our numbers from the previous presentation. Just in the first 8 months of 2017, we saw 625 individual homeless youth. So this is growing. We are seeing 60 kids a day. We are overrun in a space of less than 1,000 square feet. And last week we had 18 new kids to the street, new to the street kids. We've had over 7,000 youth interactions in 2017, now approaching 8,000 youth interactions. We do not duplicate services. We do partner with about 25 different agencies to bring services on site to Eddy House. And that ranges from everything from the food bank, who comes in and helps with SNAP signups and food donations, to notables, music therapy, to art therapy, to mental health providers, job skills, life skills, you name it, we do everything on site. About our population, 93% of our kids have lost a parent or family member, primarily parent or primary caregiver, either due to death, incarceration, or abandonment. 39% of our kids have been in the foster care system, and actually I think that's a little bit higher, it's closer to 50%. They've had some contact with foster care. 20% have actually aged out of foster care. 83% of our kids have moved more than 5 times as a child, so you can see that kind of instability. As I mentioned, we are the central intake and assessment drop-in resource center. We serve under 24. The bulk of our population are the 18 to 24, and that's where the real gap in services is here in this community. The data shows that you should not mix homeless youth with homeless adults. They are homeless for different reasons. With the adults, you might see a little bit more substance abuse, maybe issues with alcohol, more mental health issues. You're not seeing those same things with the kids. They're homeless for different reasons, primarily right now because of the affordable housing shortage, and the kids are being pushed out on the streets with downsizing parents or an increase in domestic violence. The numbers here are, I went back and did my data, so it's 71% are from Washoe County. So I know that the narrative around town is that these kids are from other areas. They are not. So it's 71% from Washoe County, 8% are from rural Nevada. We focus primarily, at least initially, on being a safe place, physically and psychologically safe. We are 100% trauma affected. So we are dealing with kids with a lot of PTSD. And so we really focus on that physical and psychological safety where they can relax that fight or flight response and take in extraneous information. We provide showers, clothing, food. It's not great food. A lot of cup of noodles are served at Eddy House, but it is hot, and they are able to get a little something to eat. We then help them with essential documents. We refer them out for medical or dental care and education. Our primary thing is to get them jobs and get them re-engaged back in school, whether that's with a GED or some kind of high school equivalency. We do, as I mentioned earlier, we do provide job skills, life skills. Everything in our building and everything in our programming has a social and emotional learning component. That is where the kids are lacking. We really focus on those soft skills, so eye contact, handshaking, and learning how to have a conversation with an adult. We also provide mental health. We do addiction groups, healthy relationships, anger management, as I mentioned, music and art therapy, grief and loss. As I mentioned, we're 100% trauma affected. 59% of our population have received some treatment for mental health issues. 60% do not have a GED or high school equivalency. 70% of our kids had an IEP or 504 plan when they were in school. So these are our kids coming out of our county, out of our schools, out of our homes, and many of them had an IEP or special ed plan when they were in school. 89% have been arrested at least once. We're talking about a lot of arrests for trespassing or loitering. That seems to happen. 92% of our kids live on the streets, in motels or couch surf. They are actually sleeping in trees in downtown Reno, which I thought was incredibly resourceful, but not safe and not okay. That shouldn't be happening here. 70% of our kids report that they are safer living on the streets than they were in their own homes. And if you think about our staggering numbers, 625, 58% of those kids have been trafficked for sex or labor. Nevada now has the fastest growing rate of homeless youth. We are number 2 in the nation per capita for human trafficking. So this is, as far as I'm concerned, and I know as far as the community is concerned, it's a public health crisis or fast approaching public health crisis. These are just some stats on Nevada. We're ranked 5th in the nation for overall homeless persons who are unsheltered. We can do the next slide. So this is where it really matters, and it should matter to our community. The U.S. Interagency Council on Homelessness estimates that the annual cost to a city for one homeless person is between $30,000 and $50,000. We estimate that it costs the city of Reno about $40,000 for a single homeless person. These numbers are based on our last year's number of kids, which is significantly less than what it is this year. So we figure that if half of Eddie House kids access the emergency rooms, use the shelter, or are picked up for loitering or trespassing, it's actually costing the city of Reno, the county, city of Sparks, about $12 million a year. And I can say that about 4 months ago, we lost one of our kids. He had been sleeping on the floor of a weekly motel. He got a bacterial infection from breathing in that yuck. He actually died in St. Mary's after 2 months of heart failure. The infection went in and killed his heart. His hospital bill, just his hospital bill, was $2 million to our community. That's one child. That should not be happening here. So we have to do something. Homeless youth do not identify as being homeless. They are 5 times more likely to sleep in a place that they shouldn't be sleeping in. And less than 8% of our homeless youth population will use the VOA shelter downtown, citing safety concerns. 54%, according to the point in time count last year, 54% would take shelter right now if it were offered. And of the kids that they counted, 17% accessed the adult shelter. We can go to the next slide. As I mentioned, safety is number one. It's the number one reason for kids not to use the adult shelters. They are preyed upon by the adult population. Even our kids who talk a very tough game will run into the house if they see older homeless walking down the streets. So it's really not safe to mix the populations. They need a separate youth-centered place for them to go at night. We can do the next slide. So today, we are in a space of less than 1,000 square feet. We see 60 kids a day. That's huge. Our biggest day has been 74 kids in that small space, no conflict, which I think speaks to my incredible staff and the fact that these kids love having a safe place to be. We are a relationship-based program. My staff knows every kid by name. We know their stories, we know their histories, we know their education. We do enforce behavior contracts, as I mentioned. Our plans in the next year are for a 24-hour drop-in center location downtown that would accommodate 50 youth a night, plus continue the drop-in services so we can continue to see the over 700 kids that we've seen this year. Ideally, it would have a commercial kitchen so we could serve nutritious meals and not cup of noodles, classroom space, therapy space, have showers on site, lockers, and really our goal is not to manage this problem. Our goal is to end youth homelessness, and I see Reno, Northern Nevada, Sparks, and Eddie House as a national model and how to show like cities how to end the problem of youth homelessness. I think we can do better than what we're doing. We are not San Francisco, we are not New York. 700 kids is a manageable problem. So it will take the community, and I hope that everyone will step up and give a hand to solve this. We are the first stop in a homeless youth continuum that we see that would encompass entire Northern Nevada. And we are also very active in the point in time count and will play a huge part in that this year. So we need to strengthen our current programming and funding streams. Funding has been a huge issue. Eddie House has been sustained just by asking people who know about us in the community. We are a data-driven agency. We probably collect the most data on this population in the country, and we are ready to push that out and actually write for it. So we are willing to share that with county, city, state agencies. Let's make Nevada shine. That's what we say. We want to increase the hours initially at our current location, work on our partnerships and that continuum of care that I mentioned, and then we want to expand the drop-in center. We need to. These kids are on the street. They will be there all winter, and they will freeze to death and die of infections. So let's not have that happen. How can you help? Make introductions. I don't have the network here. I'm fairly new to the area, so if you want to come and take a tour, if you are involved in a place that would like to come and take a tour, I do that all the time. We are looking for a building. We need people who have insight, like our health people here in this county that really have some valuable insight into how to solve these problems. Support us on social media, and really just steer them to Eddie House direction there. We need all the help we can get. So my contact information is here, and if you have any questions, I'm usually available. Thank you.
Thank you, Ms. Gare. I'm going to start down here and see if there's any questions. Councilman?
Well, I just thank you for
Gare.
sharing, and it's obviously something that's very heartbreaking to hear all of those things. I'm very interested in coming down and touring, so yes, I'm interested. And there's a lot of things we're trying to do to try to help curb homelessness at large. We have a lot of conversations about that, but our youth, without question, it'd be wonderful to see what you're doing and just continue to see how we can help.
Thank you. You know, we focus on prevention because the data shows that if you intervene before the age of 25, they don't become homeless again. And so you essentially stop the cycle of homelessness before it starts.
I definitely agree with you on that, 100%.
Any other comments down here? Down here, Dr. Hess?
I'm thankful to recognize a problem, but I'm still kind of lost as to, you know, hard idea, you know, something strong that I can really grab onto as a plan to attack it. Do you have such a plan?
We do, actually.
What is your plan?
So our plan is for a 24-hour center. What we find is if they're stable at night, they go back into school and they have successful jobs. So we have a job skills program. Since April of 2016, 160 of our youth have managed to secure employment. It's tough to keep that employment if you don't have a safe place to be at night. So without that overnight piece, we start over the next day. But we can, by providing services on site and by getting these kids working and back in school, they become productive members of our society. They don't want to be homeless. They want to be working, contributing community members. So if you can get them a safe place so they can stabilize and learn those social and emotional skills, they get off the streets.
So what size, what are you trying, have you identified what it is you need?
We have, yes. We have our budget. We've identified a space. We're looking for a space, hopefully it's near downtown, that's at least 10,000 square feet, and has room for 50 beds, preferably line of sight.
Okay, and what would you like the health department to do?
I would like the health department to help support us and really work with us to develop programming that will help with things like nutrition, medical care, all of these things that these kids don't have right now.
Thank you.
You're welcome.
Thank you, Ms. Gare. I have a couple of things. First of all, I would encourage everyone to take a tour of this. It's heartbreaking, but it's also very inspiring. And you do a great job with your data-driven approach and your very special master's degree that you brought back as a Nevadan to Northern Nevada to help us with this issue. I do have a group of women that I run around with, and we want to adopt you for a night of dinner. Can you explain to the board how that works?
So one of the things I needed when I first came back to Nevada and to Eddie House was I needed buy-in from the kids. I really wanted them to take ownership of the program and to really be involved. One of those ways that to do that was to have the Friday family meal. So every Friday at 2:30, a group, an individual, or an organization provides a hot meal. We used to say for $35, now it's $65. We incentivize all week with raffle tickets, so during that meal, we have a feedback session. The kids give us feedback, we give them feedback, and then we raffle off $5, $10 gift cards. It gets very competitive. I've actually had kids throwing dirt in the back patio in secret, gleefully over their shoulder, and then come in and say, we need some raffle tickets because somebody made a mess in the back. And so it gets very competitive, but we do that, and we sit down and eat together. It's communal, and they respond, and it created a family atmosphere. And so if you want to contact Meredith or myself, we can direct you to that, and we schedule those lunches months out. We usually do it on a Friday. We're trying to open up some other days during the week, because the need is so great, but it's often the only time they'll eat something nutritious or substantial over the weekend.
Right, and remember too, they have no commercial kitchen, which means they're not permitted for food.
Right.
So everything they eat has to be heated up in a microwave.
Yes.
So if you want to donate, keep that in mind as well.
Yes, non-perishable food.
Non-perishable food. And then I also know you're usually looking for clothes. What clothes are you looking for today?
Right now, because we've had such an influx of donations this month, we're going to hold off on the clothes until after the first of the year. But we always need socks and underwear.
Okay.
That's a big thing. Socks are really big. We see a lot of what I would consider trench foot. I'm no doctor, but it's just from the moist, cold in the feet. We see a lot of gangrenous toes.
And then did you receive a VOCA grant recently that I heard of?
We received, we have a current VOCA grant. We did submit for some more funding to hire a full-time marriage and family therapist and some other things. I haven't heard back, to be honest with you.
Okay, well, maybe I just spilled the beans, so no, don't quote me. Well, thank you very much for being here and all that you do, and whatever the Board of Health can do to help you, as Dr. Hess mentioned, we're there, and we'll be at the ribbon cuttings, the fundraisers, whatever you need, because this is a public health crisis, and this directly leads to either a great community or a not-so-lovely community. So I appreciate you, and you are a gem, and as is Meredith.
Thank you so much.
We're lucky to have you.
We appreciate it. Thank you.
Thank you. Okay. All right, I've lied. My meeting is actually at 2 p.m. with the senator, so I am going to scoot up to my office, and Dr. Novak will be taking us away from here. I do want to say, before I leave, even though I'm not I will not be able here to vote for this, I do support item number 10, which is our next item for the increase for REMSA. They can give you a business model as to why that is and actually how it doesn't affect your day-to-day life whatsoever. So I want to put that on the record, and I will shut it off. Thank you. Thank you, Dr. Novak.
You're welcome.
Sorry about the confusion, you guys.
Okay, moving on, our agenda item number 10, presentation and discussion, possible approval of REMSA request for increase 3% a year over 4 years to the average billing. Mr. Dell.
Good afternoon, Chair and Madam Chair, as you're leaving. I'm, for the record, I'm Dean Dow, President and CEO of REMSA and CareFlight. REMSA's mission includes contributing to the health of the communities we serve. REMSA currently holds 5 accreditations across all major service lines in our organization. Accreditations are the backbone of quality and safety throughout the organization and represent REMSA's commitment to meeting national and international standards. These standards ensure the highest quality of service for our patients and our communities. Our accreditations include our ground, air, and education services, as well as our communication center and the REMSA Nurse Healthline. Today's climate for REMSA, since the introduction of health care reform through the passing of the Affordable Care Act, REMSA has seen an 8 to 12% increase in overall call volume year over year and a 15% increase in Medicaid patients using ambulance services. According to the data reported in the 2016 annual update of the Community Health Improvement Plan by the Washoe County Health District, 1/3 of Washoe County's residents live in a primary care shortage area, and all of our residents live in a county in a mental health provider shortage area. Because of the increase in insured patients, along with the lack of health care providers in our region, many of those health care providers who do not accept Medicaid There's an overall increase in patients using EMS in emergency departments to access health care. REMSA is the community's healthcare safety net. When a patient calls 911, an ambulance is dispatched every time. Frequently, these patients receive an emergency response as well as an assessment and care provided by a paramedic, but the patient may not be transported. This type of cancellation and non-transport response happens with approximately 1/3 of REMSA's responses every year. That's about 24,700 calls out of 74,111 total responses. This equates to increase in expenses with no option to recover the related cost, since REMSA can only bill when a patient is transported. In addition, rapid and significant growth across the region has resulted in expanded service areas. Here's a graphic representation showing an increase in overall responses compared to the flattening of our transports. So the overall responses are in blue and transports in red. As you can see, you look at 2013 and 2014, during that 12-month period, that is where the Affordable Care Act started to take place, and you can see where the number of responses correspondingly start sharply going up. To meet this growing need, since 2013, REMSA has hired an additional 34 field providers. This does not include positions that have been replaced due to attrition, as employees have accepted other EMS jobs in the region. Because of this, REMSA is very focused on retention. It is critical that REMSA is able to recruit, retain high-quality EMS providers to maintain the level of clinical expertise it is known for. REMSA launched a new competitive compensation program that increased pay to clinical providers, aligned them to a step progression plan that has maintained a strong benefits package. To accommodate the new growth coming to our region, as you well know, a new franchise response map was implemented along with new response requirements based on geographic demand and population density. This led to population islands, or as I sometimes refer to them as fingers, like Cold Springs and Spanish Springs. That should pop up. To ensure compliance with these new requirements, REMSA added 3 fixed stations and ambulances dedicated to those areas at a total annual operating cost of $1.5 million. Since 2015, REMSA has added an additional 11 staffed ambulances per week, an approximate 18% increase over the past 2 years. Despite ongoing education efforts in our community about when to call 911, many people continue to call to get medical assistance even when it is not an emergency. So, in response to our continuing growth in our communities, REMSA has been challenged to respond to more than just 911 calls. Special programs were implemented to meet the changing needs of our community outside of the traditional standard EMS response. These programs use highly trained staff without fees for services and include the Technical Emergency Medical Services, or TEMS team, trained to attach to SWAT teams to provide care at active scenes, the search and rescue paramedics that support the Washoe County Search and Rescue Team, and the Advanced Life Support Bike Team used to service high volume weekends and cover high density populations during events. Responses to events like the air race crash, as well as the recent active shooter incident at the Montage, are examples of meeting the community's needs to provide high quality health care resources in non-traditional ways. In response to an increase in 911 calls, REMSA identified 2 additional innovative solutions, the Nurse Health Line and Omega Protocols. Both use medically trained registered nurses and communication specialists to facilitate getting patients to the right level of care, which may include sending an ambulance or may include recommending a visit to an urgent care or a primary care office. It is critical for REMSA to stay current and provide up-to-date technology for patient care. In the last 2 years, REMSA has invested more than $5 million in capital improvements and upgrades. Of that, this includes $2.1 million in ambulances and ambulance-related purchases, upgrades, and refurbishments. It also accounts for $2.2 million in capital investments used to enhance our emergency medical dispatch center, radio infrastructure to ensure future local and federal compliance and interagency capabilities. More than $700,000 was invested for IT improvements and other vital medical equipment necessary for paramedics and EMTs to work safely in their field. As previously noted, based on the current reimbursement practices, this increase will only impact patients with private insurance. 70% of REMSA's patients are Medicare and Medicaid. They will not be impacted by the increase since both of these government programs reimburse based on their payment schedules without regard for the actual bill or the cost of providing those services. Based on the current reimbursement structure, REMSA typically receives only about 34 cents for every billed dollar. The rate increase REMSA is seeking is 3% a year for 4 years. The impact will be $34 to the average allowable bill for the first year of the increase. The actual payment from insurers will be subject to lower reimbursement based on what they actually pay, as all insurers are not required to pay what is charged. We remain committed to transparency. The ability to monitor the impact of this increase for REMSA overall's performance will be possible through our annual financial audit that is prepared and presented to the EMS Oversight Office. REMSA also presents its average allowable bill as part of the monthly compliance report presented to this board. In addition, we will provide an annual update to the board highlighting our ongoing infrastructure investments as well as our response to growth across the region. So, I thank you for your time. I appreciate the partnership that our organizations have had with the Board of Health and our other partners in this region, and I'm happy to answer any questions you may have at this time.
Do we have any questions?
I'm just I'm still a little confused a bit about the the calls without transport things too. What kinds of issues can you do to get that number lowered, or that you're not actually a third of which you say you don't transport, or how can you actually change that number?
Mr. Young, what we're actively doing is working, as I noted, with the nurse health line in the Omega calls structure, and we put the calling party that calls 911 through an emergency medical dispatch process, and utilizing the EMD dispatchers and the nurses in the call center, we can help navigate non-priority 1 and non-priority 2 calls, if you will, into other healthcare pathways, so they don't necessarily stay in the 911 pathway. Does that answer your question?
Yeah, is that going to lower that number or get that number fixed?
Well, it honestly will actually increase the number of non-transports. So, but it's, as we've presented to many organizations, I once had a person say, well, you're trying to put yourself out of business. To some degree, maybe I am. But it actually is better for the health system overall to take non-acute patients and put them in better pathways as opposed to just, here's an ambulance, go to the emergency department, here's an ambulance, go to the emergency department.
Thanks.
I'm a little bit concerned about 3% increase for 4 years without knowing where we're going to be. I just last night, looked up cost of living increases, and that exceeds the current cost of living annual cost of living increase, and will actually end up being just under 14% at the end of those 4 years, which is a pretty good chunk of money actually. $1,000+ charge. We're talking about $140 of increase, and in 4 years, and it seems to me asking to do this for 4 years is a little bit premature.
Dr. Hess, I understand your question. I would present that as any organization, What we strategically try to do is obviously budget to the future and budget to where we think we will be as an organization in the future. We've done an analysis over the last 4 years, and our expenses are increasing at 4% on average over each year over the last 4 years. So $34, $35 from this increase, essentially it would be close to that same amount for the next year for each 3 additional years.
Now, is that your cost per transport, or is that your overall
My cost for transport right now, just responding, is approximately $495.
Because when I'm because of the growth of the county, you've grown and you've had to keep up with that growth, which increases your total.
Correct.
But I'm just wondering if it really increases your individual transport by that much. The cost for the individual transport.
It increases our cost, obviously.
Well, sure, but in general, but does it really increase it per transport? Because you're going to have, if you're going to have a larger population, you're going to have more transports and more calls.
But also take into consideration that the utilization goes up, as that graph represented. The utilization of the 911 system goes up, but the transports don't necessarily go up. Every time someone calls 911, it's not necessarily a priority 1 or a priority 2 level call, a life-threatening call. The challenge that this area is seeing, as well as other areas across the country, is the increase in utilization is from the low priority, no priority, non-acute level of patient seeking an entryway into healthcare.
Okay. Chief Brown?
And Dr. Hess, I echo some of your concerns and some of the points that you're bringing out. One thing that caught me about this, reading through the packet though, is that 70% of the patients you're transporting and trying to receive payment back on are Medicaid and Medicare patients.
That's correct.
So roughly 30% of those patients that you're out there getting the reimbursements from are coming from private and self-pay.
Correct.
So when you look at that, I look at it, I manage an ambulance service, and I like what you said about the 4% per year, because that's what we used to budget. We were still behind. I look at your 4 years at 3%, and I might be beat up by some folks, but I almost look at, are you asking for enough? Because of the changes that we're seeing in the future when it comes to healthcare. But, I feel comfortable with what you predict you potentially have, because that's your industry we're discussing today. But we're gonna see more and more folks that are gonna go on to the managed healthcare system, which is gonna push them into that Medicaid and Medicare area. We're gonna see less that are gonna be on the private pay insurance, and that's where you're trying to recoup your losses with that $34 per run.
Chief, that's correct.
Okay. So I just, that's one area where I looked at and took a good look at it. I'm supportive of what you're doing here. I would just hope in the next 4 years we don't see you coming back and asking for higher increases after you decided on the 3%, that's for sure. But
again, as you well know, this body gets to watch what our organization does very closely.
No, I appreciate it. I appreciate that. Thank you.
Thank you.
Hello. Yeah, 2 things. One, I think it's important to look at and know that this kind of increase hasn't been happening. And so, though it might even seem the cost of living isn't equal to you, if you match when's the last time we've seen an increase of any sizable?
From what our research indicates, and as you well know, I've been here for 2 years, so we went back to folks in our organization that have been here longer than I, and went back and looked through minutes and meeting minutes and everything else we could look at. And we came up with the impression it was about 9 or 10 years ago.
So if you took 10 years, and there might have been some minor increases here and there, but nothing substantial enough to get you over the hump of where you need to go. If you put that together, we're way lacking on bringing any type of strong strategy finances to be able to hit what we need for our region. And the second thing I think we really need to look at, this is something we do in our city, it's something we're always looking to make sure we can have retention of solid employees. And for us, part of our responsibility is to help equip these guys to have that ability to do so. And so our concern, especially with all the paramedic things that's happening, these guys train them, City of Sparks steals them, we do, it's the truth, and so does Reno, and so does other places, and they really need to make sure they have a bone in the fight, that they can retain some very strong employees. I mean, we're asking them to make sure they hit certain numbers, and we read through I read through your complaints every time I get this, and we want employees that are willing and have the ability to take care of that. But if you're losing all your best employees because we're not paying them and keeping up with the housing and all that stuff, so to me, I think it's real important we look at that at large, that, you know, no one likes charging anybody more than we have to. No one, we really don't. But these are one of those things that if we want to make sure we have the best, well, the best when it comes to our ambulance services, we need to make sure you have some of the tools you need. So that's my opinion on that.
Okay.
I'm ready to make a motion.
Okay, go ahead.
If you'd like. I move to approve, well, is there a certain particular moves? I just move to approve what was been asked in the sense of raising for the next 4 years, the 3% for REMSA, and look forward to seeing in strategy how we're going to see this unfold.
I'll second that motion.
We have a motion by Councilman Dyer, Chief Brown seconds. I do want to mention that Mr. Delgado, when he left, and also Councilman John is in support of this motion also, so I'm going to go ahead and call for a vote.
Can you read, will we be looking at how you're doing each year?
Yes, sir.
Okay.
That was one of his last slides that was discussed, that we come back and find out how we're doing. We have a vote. All in favor?
Aye.
Against? Motion carries unanimously.
Thank you all very much. Have a good afternoon.
Good presentation. Okay. JW, you're on.
Good afternoon, Mr. Chair, members of the board. You guys have 2 franchise compliance reports in front of you. We'll start with October today. I would like to highlight just before we start that thank you to Mr. Dick for pointing out that one of the charts came across between October and November with some different data for early spring. We contacted our vendor early this morning and found out that due to a downtime at EMS surveys in October, they ran the report manually, and wouldn't you know, the human error that touched it triggered the wrong thing. So Ms. Rogers actually provided you guys a new chart today to show that they have corrected that. They reran the data using their automated system, which removes the human element, and everything seemed to work just fine. So if there's no questions on the report, I will. That was the handout you gave in the beginning.
Any questions? Do I hear a motion to accept the report?
Motion to accept the report as presented.
Second?
Second.
Second. Who seconded that? Tom? Okay, second. All in favor?
Aye.
Good. Aye. Opposed? Next.
Item 11B is our public relations report. We've made our report and the compliance report more robust to hopefully save time and put the pertinent stuff in there. So if you have no questions about that, I will leave that update to what's in your report.
Thank you.
I do have one question.
Sure.
I just want a little bit of information how you guys are using the flirty drones, because we just, as a city, I think it's so cool, and I think there's some real possibility here, and we want to support that. I mean, at least I can tell you, I want to support that. I can't speak for everybody, but I think that it's a pretty awesome thing. So if you could explain a little bit on that.
Absolutely. Thank you, Councilman. We entered into a partnership with Flirty, who approached us and said, hey, we have an idea. We want to try this. We want to look at, is there a chance where we could deliver an AED faster in certain areas than we know that we can get an ambulance or a fire truck to that location? So working with our data and working with the county's data, and Heather Kerwin from the county, who's provided assistance to us, we've actually helped Flirty identify in our region what are some areas that could really benefit from a drone launching based off our CAD. So when our CAD recognizes that it's a cardiac arrest, automatically triggering that drone to launch with an AED and fly to that location. And then we're working within our own dispatch center with our medical dispatchers to then be able to provide pre-arrival instructions that go beyond just do CPR. They include go out, get the AED from the drone that's in your backyard, bring it in, and here's how you use it. So we're really trying to incorporate and develop a program that can bring that AED to the areas we know could benefit the most from it and actually start that process faster than any of us can get there. We're hoping to launch tests in beginning part of 2018.
Can we make sure we get some kind of watch this unfold a little bit. I think
Oh,
it's pretty wonderful, but I do believe it's going to help as well. I think it's something worthy of our attention to know a little more about.
Absolutely. I'd be happy to provide updates as we go along.
I got a question that was, somebody asked me the other day when we were talking about it. What happens to the drone if it goes in the wrong place? Do we have a way of recovering this?
You know, I'd be happy to bring in the gentleman from Fluidity to talk about how they track and follow their drones. Our Care Flight division had the same type of question in regard to how safe is it with drones flying to emergency areas. And, you know, these drones, Chief Brown knows that, you know, the commercial drones that we're dealing with and we're seeing in our region are actually flying with technology similar to aircraft. So you know where they are, they're tracked, other aircraft can see them, and they're very safe. So I'd be happy to get that question answered and bring them in for you.
Thank you. I appreciate that. Okay, I don't think we need to have, do you need a vote on that?
No, not on
Okay.
that, but Mr. Chair, staff has asked that item number 10 be reopened and some direction given to staff as to when the effective date of the increases to take place.
Oh, I think we can ask that, Mr. Dell.
January 1st will be fine.
So do you need me to officially put that into the motion?
I do.
So can we add that to the motion that it will start January 1st? And do we have a second?
Second.
Second.
All in favor of the amendment?
Aye.
Thank you.
Ms. Hammer, you good?
Good.
Go good, thank you.
Mr. Chair?
Sure.
I just wanted to make clear that we had 2 action items for both the October and November report. Did we get them both?
I'm about to do November now.
Okay. Sorry.
No, you're. I tried to follow Ms. Rogers' agenda very closely. She did a very good job. She did a very good job. Typically, we present November and January because of the early board meeting, but Ms. Rogers was very persistent that we make it happen, and we made it happen, so thank you for your support in that. So you've all been provided November's report. In that report, Chief Brown reached out to us yesterday. You'll notice that in the dates of service column for the comments received on EMS survey, we have dates in the November report that include October and some September dates. I also reached out to the vendor about that. What happens is if people call back or we receive comments from previous months, so you guys don't miss any comments, if they come in an earlier time, those are included in that report. So some months you might see more responses than other months in the comment section. We will always get 150 unless there's a glitch, but comment-wise, you might see some lag in the comments. But they're all different comments, and they are provided from previous months just to make sure that we didn't skip anything for your review. I'm open.
Any questions about November? Okay, good. Hearing no questions, do I have a motion?
Motion to accept.
Second. Chief Brown, second. All in favor?
Aye.
Opposed? Passed unanimously. Good.
11D, I'll treat just like 11B. If you have any questions about our public relations report, I'm happy to answer them.
Any questions? Hearing none, time to move on. Thank you very much.
Thank you very much.
Okay, next item, number 12 on the agenda is the presentation and possible acceptance of the revised strategic plan. Ms. Peters.
Good afternoon, Katrina Peters, Director of Programs and Projects for the Washoe County Health District. I'm here today to present for your approval a revised Washoe County Health District Strategic Plan. Well, hang on one second for some slides. All right. So go ahead. So again, I'm here to seek your approval for the revised strategic plan. We had a few minor revisions, and I'm just going to discuss those really briefly. The first is we added a summary of the new information that was shared at the retreat. So all of you were in attendance with the exception of Dr. Novak, and we shared some information from that community health needs assessment and some other strategic priorities for consideration. I also updated the staffing assignments. We've had some staffing turnover, so we made those revisions to reflect current staff. Then we also added a table to show cross-divisional collaboration. I'll give a little summary of that. Next slide, please. So to discuss the goals and outcomes in a little more detail, under Goal 2.2, we added an outcome to decrease the number of inappropriate 911 calls. And the initiative that lays underneath that is to work through a marketing plan to try to achieve that goal. Under Goal 4.5, we added an outcome that relates to implementing the new community health improvement plan. So that'll be the 2018 through 2020 community, Truckee Meadows Healthy Communities Community Health Improvement Plan. And then the third outcome that was added is under Goal 6.3, and that's to reflect our pursuit of accreditation. And to briefly go over the cross-collaboration table, we have a total of 19 goals. Of those 19, 12 out of the 19 involve more than 3 divisions, and 8 out of the 19 involve 4 more divisions. So we really wanted to show here how these goals really spread across multiple divisions and have lots of folks working to try to achieve that goal. And with that, I'll take any questions.
Do you have any questions?
I have a question.
Okay.
So, one, it was a great retreat. It was very much enjoyable to sit and do all that. I still, reading through this, one of the things that I would kind of throw out, and it has to do with the subject, and I throw out to our health board and everybody else, I still would love to see something in here that talks about families. And the reason why is I strongly believe strategy-wise, what we're talking about doing, even in light of what we just saw in one of our things, is 70% of kids feel safer on the street than they do at home. That's a huge concern. And I think when we talk about health needs, we have to approach that. And in our conversation we had together regarding this, we don't have parenting classes going on that we're paying for. And I'm not saying there's an immediate fix, but I just want to continue to raise that flag up, that I think one of our #1 ways to make a difference is making sure these parents are able to not have 70% of these kids.
But that's just 70% of those kids that are on the street. It's not 70% of all kids.
I understand that, yeah. But I work, in my life, I work with families and students and people all the time. And for us to not realize that families and parents are our first line of defense, I think is a mistake. You don't have to agree with me, doctor, but I can tell you in my line of work, I strongly don't believe we are the first line of defense.
No,
I think
disagree
families.
with you. I just think you're making it sound worse than it is, actually.
No,
it's not good, but it's
I'm not trying to do that, and I do apologize for that. But I can tell you, it's not good. And if we want to talk about making a difference in health, I think we work with our first line of defense, I think, which is parents. And I don't see that in our, I know it was brought up a couple times in different areas, but I don't see it as part of our strategy. And I still want to raise that flag.
And if I could respond to Councilman Dare, I believe that that your comments about families were heard and appreciated during the meeting, and Mr. Cutts will be providing an update with his monthly report. I think we have some opportunities that we're pursuing in those areas. So hopefully once you hear from Mr. Cutts, you'll feel better that we're working to try to move forward in that area.
Thank you.
Do I have a motion to accept the report?
I move we accept the report.
Good.
Second.
Good.
Thank you.
Hearing no other questions, comments, all in favor?
Aye.
Opposed? Carries unanimously. Good, thank you very much. Okay, moving on. Number 12, possible approval of the proposed Washoe County District Health Board calendar. Mr. Dick.
All right. Actually, this is item 13, just for clarity on that. And we had proposed a calendar, which somehow just escaped from my file. Here it is. Of meeting dates for District Board of Health through the calendar year 2018. And so we basically proposed our standard schedule of the 4th Thursday of the month with, for November, a tentative meeting date, which would be on the November 1st for a workshop, and then the 15th for a board meeting. Marked as tentative because we believe that the way the schedule works between moving the meetings up earlier in December and November, that it may be advantageous to skip the November meeting as we did this year, and then we'd have the December meeting on the 13th. So we wanted to propose that schedule for the board for consideration for the 2018 meeting calendar.
Okay. Any questions for Mr. Dick? Any comments? A motion?
I'd move to approve.
Okay.
And I would agree that probably taking November off if that's doable. Do we just wait on that and see if we actually need a meeting?
That's what I'm proposing, is we just put it on the calendars so that if we need the meeting, we could hold it, but with the intention that we would cancel it if we didn't have something urgent.
It's fantastic.
Okay. Hearing that, all in favor?
Aye.
Yes? No? Pass.
Was there a second?
Yes.
I thought he was the first.
I was the first and
I second.
Dr. Novak.
Thank
I'm
you.
sorry. Okay, and I will make sure that Chairman John gets the calendar so it's on her schedule too. Okay, moving right along. Yes. Yes. So far, so good. Okay, proposed appointment of 2 new food protection hearing and advisory board members. Go ahead, Jim.
Thank you.
It doesn't sound like it, but it's on.
Oh, all right, thank you. Chairman, members of the board, Chad Weston for the record. Come before you today regarding the appointment of 2 new food protection hearing and advisory board members. We've had a couple members resign. You have in your packet an overview of the purpose of the board. And these 2 members that we're talking about would be representatives of the food service industry. I guess just by a little bit of background, this board considers appeals by aggrieved persons and also variance applications in the regulation of Washoe County and by the District Board of Health regarding food establishments primarily. The vacancies exist due to the resignations of Mr. Vern Martin and Mr. Jerry Montoya. Staff will continue to gauge the interest of existing board members and if additional appointments are necessary. It's worth noting Mr. Chris Thompson is one of the persons that you have a resume for. He was recommended as an appointee by Mr. Vern Martin, and he was a committed and respected member of the board prior to his resignation. And Mr. Thompson had worked closely in the food establishment as well as in the design aspect of food establishments. We also have Mr. George Heinerman with experience managing food establishments and construction projects. And he is also very well versed in food safety and food service issues. And we have a resume from Mr. Jesus Gutierrez, who's also expressed interest. He would like to be considered. He owns and operates Marichui's Mexican restaurant in Reno and has a history of compliance with the district and our food safety regulations. So the Environmental Health Division recommends that the District Board of Health appoint Mr. Chris Thompson to the Food Protection Hearing and Advisory Board. We would also support the appointment of either Mr. George Heinerman or Mr. Jesus Gutierrez for the other vacancy. If you have any questions, I'm available.
Do we have any questions?
How do you pick? Based on information I have, which of the other 2 should.
That's up to you making a motion.
Well, I have a question. Tom, do you know anything?
I am acquainted with one of them, but I don't really know anybody to make a comment in terms of their competence in this matter. It's a very, very important board, I think, or a group advisory committee to do that. But I would hope that possibly you and your staff would provide some sort of evaluation of this board if that's possible for a valid decision.
Thank you.
Yes, we have resumes for 2 of them.
Yeah, I'm just looking at the information, and I still. Excluded or?
Yeah, we do have a resume for the third, it's just the third one's not.
Oh, I guess, I'm sorry, I missed that.
Yeah.
Okay. Do you want to make a motion?
Sure, I'll make a motion, we'll try it. So, and I'm basing this just looking at experience. So if anybody's looking at this, I'm not just picking a name I like, I promise. But the reading, I've read through these before, the ones that I had gotten before. And I would move that Christopher Thompson and George Heineman are accepted as advisory, on the advisory board that you're talking about.
Do we have a second?
I'll second that, and, you know, I gotta say thank you to all of them for applying.
Yes.
It's like the positions here on the District Board of Health, it takes a commitment, and it's nice to see people step up, especially in the industry that's being represented. And, so I do think that those two, I'll second that.
Okay, we have a first by Councilman Dyer and a second by Brown. All in favor?
Aye.
Opposed? None? So it carries. Good. Got 2 new board members.
Thank you. I'll pass on the appreciation to all the candidates.
Can we also just say, can make sure for Jesus Gutierrez, please continue to be involved. I mean, it's part of it. We only can go off of what we kind of read when it comes to some of these things. I'm sure he's a wonderful man. I don't know him, and so so just with that said, it'd be great to see him continue to want to be involved, and we would continue open doors. Obviously, you only had 2 spots, and
Right.
maybe we just keep him in mind or keep his stuff.
Right. I will pass that
Thank you
on.
very
We have
much.
lots of opportunities for workshops and
Yes.
groups that look at new requirements, so we'll definitely keep them involved.
Good.
Thank you.
Thank you very much. Okay, that moves on to number 15, staff reports and program updates. Ms. Albert. Oh, there you are.
I was
Hi.
on deck. Good afternoon, members of the board. For the record, Charlene Albee, I'm the director of the Air Quality Management Division. We are currently, November 1st started our Know the Code season, which is our wood stove program at its highest. This is the combination of not only our regulatory authority, but our community outreach and our actual community partners that, you know, our participation. We have a new radio ad that we have been receiving a tremendous amount of positive response from people not in our industry. And so I wanted to share that with you today just to, for fun. It's really cute. Well, I will say while we're getting that going, that we are currently in our first major inversion of the year. And in years past, we've found that when we have these inversions like this, that usually we have our first red no burn day in the early part of December. We have all been very surprised that with this inversion, we have yet to have a red burn this week. And I think it really is showing that it's the effectiveness of our wood stove program, that we not only have been able to get the old dirty devices out through the change of ownership process. Our rebate program that we have, we're getting a lot of the older stoves out, newer, more efficient ones in. And then also our outreach is actually being very effective, that we've got the Weather Service putting out our forecasting, helping us there through our social media. We have the news stations, each of the TV stations has been really good to put it out. And we actually did even include a tweet this week thanking the public for helping, that obviously the work that they're doing, recognizing our program has really paid off, that we haven't had a burn. And okay, here we go. Okay, well, if you hear it on the radio, pay attention, they did a very good job. We try to update the messages every couple of years just to keep it fresh, and I think that they really did a great job this year. It really focuses on the green, yellow, red and catches your attention, so we're hoping it's working.
And while Van Gogh's paintings exhibit shades of genius, I think you'll find these next 3 pieces to be very powerful. Yes, this is titled Green. It alludes to dashed dreams and envy and...
Actually, it means you can burn.
Right. And over here, this next one is called...
Oh, that's yellow.
Why, yes it is. I see we have an art fan.
Not really. I just like clean skies.
Clean skies?
Yeah. You see, the Washoe County Health District came up with green, yellow, and the one over there, that's red, so that people know when it's safe to burn.
Rather like codes disguised as art.
Exactly. And their website, ourcleanair.com, lists the latest codes.
Brilliant.
Yeah, a masterpiece.
For the latest burn codes, visit ourcleanair.com. Brought to you by the Washoe County Health District.
Do you know when we're going to get to the dogs playing poker?
Oh dear.
Very good.
Thank you. So yeah, they did a really, really good job. And I think it's important to realize that with this program, as much time as we can keep outside of a burn ban, that demonstrates we are meeting the ambient air quality standards for PM 2.5, which shows a significant health benefit to the community. I did have one other update that I wanted to give you. A couple months ago, we brought before you the regulations for the gasoline dispensing facilities and the removal of phase 2. In the process of putting that packet together to submit to EPA, we found out that we had originally thought it was not going to be a SIP submittal for our state implementation plan. Staff did discover, with the help of the state, that there was one regulation, one line in there that requires a drop tube when they fill the tanks in the ground, that the tube goes to the bottom of the tank so that they don't splash and create excess emissions. That was from a SIP that was submitted in the 70s and had not really been carried forward, so there was a lot of cross-checking going on before it gets to EPA. So those regulations had only been published twice in the newspaper, thinking it wasn't a SIP submittal. Turns out it is a SIP submittal, so the month of December we are republishing. We did check with Ms. Admiran, and that was the advice we were given. So we're republishing now. We did leave in our notification if anybody wanted another workshop, we would have it. We've had no comments submitted to date. So in January, we're going to bring the same package back with the business impact statement in January and the regulations in February. So just wanted to give you a heads up that that's the reason we had to go backwards. So. And I will tell you that I made a policy change that from now on everything will be published 3 times, regardless of it, if it has to or not. So, and I'm available for any questions if anybody has any.
Any questions? Good.
I have one comment. I just want to point out that you guys did a great job on this first portion, talking about the 10% increase. That's a very big deal on your report here, that proposed 30% cut was going to be there, but because of your work and what you've done instead, we went the other direction. And so, good work.
Thank you. I think what has happened is they're continuing to look at the cooperative federalism, and they still are looking at cutting EPA's budget, but recognizing that work that's not going to be done at the federal level is going to be pushed to the state level, so they are responding with a proposed increase, or at least maintaining the level of funding for us to do that work.
So you just say they're going to give you more work? Is that what you just said?
Exactly.
Well, congratulations.
We have been told that's going to happen. So. All righty. Thank you.
Tommy. Okay, moving on to the next report. Mr. Cutts.
Good afternoon, Mr. Chair, members of the Board of Health. Steve Cutts for the record. So a couple of things. Mr. Dick was right. I will talk to you about an exciting opportunity that we have that involves family. Another thing, it's kind of a cross-programmatic, if you would, comment on family is Jennifer Howell, our sexual health program coordinator who is here today, reminded me that for the Eddy House, we do provide monthly STD HIV testing. We find that's a great way to build rapport and intersect with the youth and the teens that are there, hopefully being more on the prevention side and engaging with them and keeping them off out of other opportunities to intersect with them. So we appreciate what Jen has done with the Eddy House, as well as all of our offsite community testing and that of our wonderful sexual health program staff. So I'm very appreciative of that. Along the lines of sexual health, I just wanted to let you know, as the first page of our report states, it was World AIDS Day on December 1st. I just wanted to reiterate the emphasis on treatment as prevention. That is very big in the HIV world right now, both for not only negative individuals, but those also people living with HIV. It's a very exciting turning point in this epidemic, and we continue to look for ways to support the goal to ending this epidemic, and we think this is a great step in that direction. Moving on and getting to Councilman Dare's comments about family, and we kind of alluded to this at our strategic planning session in November, that there may be opportunities in the future to increase our work with families. If you look at page 4 of our report, start talking about nurse-family partnership. We're very excited about this opportunity. It kind of happened in a little bit of a whirlwind fashion. A number of the board was not here for a fundamental review that occurred in 2014 and was presented in February of 2014. But we had a much larger maternal child home visitation program at that time. The fundamental review basically said, it's a nice program, but it's not evidence-based, and either shore it up and make it evidence-based or consider dissolving that program. We didn't have the funding at that time, and so we did end home visitation later that summer in 2014 and redistributed staff and resources to other programs. So I just wanted to give you a little bit more information than what's in the board report regarding nurse-family partnership. So again, their mission, Nurse-Family Partnership, positively transforms the lives of vulnerable babies, mothers, and families. Their vision is a future where all children are healthy, families thrive, communities prosper, and the cycle of poverty is broken. This is a voluntary program. A typical client is a first-time mother, meets low-income criteria, receives first home visit by the end of her 28th week of pregnancy. She's visited throughout her pregnancy and first 2 years of her child's life, with gradually decreasing the frequency of the visits. The nurses would carry a caseload of 25 to 30 active clients each. The program supervisor for Nurse-Family Partnership would provide one-on-one clinical supervision visits weekly case conference and team meetings, and joint home visits. And we'd also be establishing a community advisory board that meets at least quarterly. We know right off the bat there had been much conversation with Renown Health, and they are very interested in being part of the community advisory board. Some community impact points I wanted to point out is that NFP addresses family, poverty, educational attainment, school success, crime rates, etc. So many things that have been mentioned or addressed through community health needs assessment, as well as the community health improvement plan. So it's a really great intersection of this program, the health district, my division, as well as the CHIP. Compared with similar populations, NFP results include an 18% reduction in preterm births, increased breastfeeding rates, increased by 21%, an increased number of children up to date with immunizations by 6 months, so they showed an increase of 19%. And as of September 2016, NFP was serving clients in 42 states in the United States. There is a sustainability plan in discussion that the State Division of Public and Behavioral Health will be working on Medicaid reimbursement for services and grants such as the MIECHV, which Linda, you'll have to remind me what that is.
Maternal Infant Early Childhood Home Visiting.
Maternal Infant Early Child Home Visiting. Yeah, okay, thank you. Other grant dollars, and we'd also look toward additional grant funding. Southern Nevada Health District has also had the Nurse Family Partnership Program since 2008. They currently have 7 home nurse visitors, and through this grant application, they are applying for 1 additional home visitor. So we're very excited about the opportunity. We'll keep you apprised as to what the outcome of our grant application was. Again, I'd like to thank our health officer, Kevin Dick, Anna Heenan, Nancy Kearns-Cummins, and of course Linda, who wrote what we think is a great application. It was a bit of a crazy process, but we're very proud of the application we put forth, and we're really looking forward to this being funded and having a positive impact in our community.
Any questions?
Okay.
Comments?
I just want to say thank you.
Yeah.
Okay, good.
You're
Good-
welcome.
Good job. Thank you, sir.
Good work.
Thank you. Any other questions for me while I'm up here?
No. Good.
All right, thank you very much.
Okay, Mr. Watson.
All right, Chad Westham for the record. Mr. Chairman, members of the board. So you have a copy of our monthly division reports and the different projects we've been working on. I'm going to highlight just a couple items. One is that NDEP, the Health District, and Tumwa have been working diligently in the last few months on the waiver that has been discussed at great length, and we were able to reach agreement. There was a renewed waiver signed, issued and signed on December 4th of this year, and that's between Washoe County Health District, NDEP, well, I'm sorry, it's between Washoe County Health District and Tumwa, signed by Health Officer Kevin Dick with the support of NDEP. So this waiver now exempts Tumwa from the Health District review of water projects for water main additions that are 500 feet or less, and they're ones that are not associated with NRS and NAC 278 regarding final water maps. And this is for Tumwa System 190, which is a majority of the water system in this area. So in the future, though, if the district encounters this sort of situation between the district and Tumwa, we do want to say that we will notify the District Board of Health and the challenges we are working on and how we're going to work through it. And so we will make that pledge. Additionally, we want to let you know that the district is in discussion with NDEP and Tumwa on further matters, possibly expanding the current waiver that we just were issued on December 4th or creating an additional waiver. The goal is to reduce the amount of review needed for development projects, but still protect the community water systems and the residents of Washoe County. Any questions on that before I move on to another topic?
Question?
Yeah, this has been obviously a conversation that a lot of us have been having, especially in jurisdictionals, in our areas and stuff, so
Right.
Thank you, and I think you have a great answer, and thank you for your commitment to, because our goal is never to come in and try to do your job. If you do know that, that's never what we want to do. We appreciate your expertise and what you guys do, but I do appreciate when there's something that could cause the kind of waves with that particular thing did that we're included, at least knowing, even if it's, sometimes it has to happen. I mean,
Right.
I'm not even saying that there would never be a day we never take a waiver away from somebody, because that actually might be a thing one day, but if that's the case, at least we know the tidal wave that's about to hit us, and so that would be part of, so we do appreciate your work, and
Yeah.
thank you.
No, thank you. And we're all about communication and transparency and more of it in as much as possible. It's concepts for everything we do, really. Okay, so moving on. The other big project that we're working on in environmental health, Picnic Pub and Patio, located at 235 Flint Street in Reno. They had a food establishment, and they've had a bar permit and a food establishment permit. And they did have the food establishment permit suspended on November 17th because they were found in non-compliance and there was a concern of a substantial health hazard. Their bar permit is still in effect. The operation that they are working on and their new business model that they're pursuing, that's going to require a variance from the board that we were just talking about, the Food Protection Board. And as was already mentioned today, we did schedule a hearing last week. We didn't have a quorum, so now we're going to reschedule it for this next week. So we're working with Picnic to try and support that business model. That's going to require, for your information, a variance from 3 sections of Washoe County regulations, 200.055B, 200.055E, and section 060.250A, and this is all in the packet. But in short, they want to allow customers to cook, baste, and season food items that they bring with them, rather than getting the food from the establishment, which is more traditional with restaurants. They also want to allow customers to serve this food to people in their party, whereas the actual regulations currently say in this sort of situation you would only serve yourself. And then there's household type equipment out on their patio that they want to use to hold their food, and whereas food establishments are required to have commercial grade, more stainless steel type items, and so they're appropriately wanting a variance from that as well. So, but in short, not to go too long, there's a number of things that led up to the variance and the suspension. So a quick overview would be that picnic.
Mr. Chairman, I'm sorry to interrupt, but this is something that's going before the Food Advisory Hearing Board next week, and I think that that would be the proper forum for the facts to come out. Picnic hasn't been, it's not on the agenda that this board would be getting in-depth information about the enforcement actions and the variance actions that are going on, so it would be my advice that once it goes to the hearing board, that it can be brought back as an agendized item for information for this board.
Thank you. I totally agree with that. So
okay,
if we can kind of
absolutely
curtail this part of the comments and move on if we got more.
That's, I understand. Thank you.
Thank you.
And so in short, there's a number of other items in the report that we wrote and tried to include some of our successes and challenges we're working through. So if you have any questions on the report or these other items, please let me know, and we're available for you.
Any other questions, comments? Okay, thank you very much.
Thank you.
Okay, Dr. Todd. Epidemiology on public health preparedness. A very busy man lately.
Good afternoon. Randall Todd for the record. You have my written report in your packet. The only thing I would update you on is the seasonal influenza surveillance, because it seems like those numbers are constantly changing. So your board packet has data up through week 47, and we're now through week 49. But the total number that we have right now is 162, up from 151, and the number of or the percentage is now at 2.3%. So that is for our Sentinel providers, we're at 2.3%. The regional baseline is at 2.4%, so we're just underneath that regional baseline. It's interesting when you look at the map for the U.S., Nevada is one of only a handful of states that are still listed as sporadic influenza activity. Everybody else is local, regional, or widespread, and so I have a feeling that we'll be joining the ranks of at least the local activity, if not regional activity, fairly shortly, because we're getting right up there. But that's what's going on. I'd be happy to entertain any questions if there are any from other parts of my report.
Any other questions? Good.
Thank you.
Thank you. Okay, we're down to the big stuff. Mr. Dick.
Well, I just have a brief update for you today on my monthly report. I reported on public health accreditation, and I'm pleased to report that at the time that I submitted the report, we reported we had 24 of the needed 213 document examples gathered. Those were actually ones that we reviewed and approved and felt like they fully met what we were required to do for FAB. Since that time, we now have 46 of documentation examples that we've reviewed and approved, and we think fully are meeting the FAB accreditation requirements. So we're at basically 21% of that 213 document examples that we need for accreditation that we've got in our belt. So far, we'll continue to work along in this process. Ms. Peters and Ms. Hilliard are planning travel back to FAB, the Public Health Accreditation Board, in February for training by FAB, and after that then they'll open up their electronic document submittal system for us. So we're continuing to charge on that accreditation. I know it's a priority for the board, and we'll continue to report on that for you.
It's mine.
That's all I have.
That's
I'd be
it.
happy to answer any questions.
Okay. Any questions? Hearing none, good. Thank you very much. Let's move on. Do we have board comments? Anything for future agendas? Mr. Young.
No, I'm fine. I'm just interested in how we can work out this, the self-cooking type operations. I guess a cool concept, but there's some challenges.
Yes, I agree. Dr. Hess?
There's two things actually. One is in our package today, we got an emergency operations plan for the department, or for the district, health district, and there's one. It's interesting because one just really got put together for the Inter-Hospital Council, HCC, for hospital emergency operations planning. And I'm wondering if it would be, if the other members of the board are interested in if that could be maybe included in the next packet or something. So, somehow getting all that stuff together.
Agreed.
Are you guys interested in that?
Yes, please.
Maybe a presentation on it.
That would be great too, yeah.
I think that's even a better idea.
Yeah. The second thing I had was how can we work on future funding for this scholarship in public health? I don't have a good answer yet, but certainly it's something I'd kind of like to keep on the table.
Good. Chief Brown?
I have one thing, something I don't know if we work with. The WNDD is the Western Nevada Development District. I serve on that board. Do we go to them to look for grants? And that's something to look into. They just did a presentation even in Sparks, and there's some federal grant things through them because of the entity by which it's regional that could open up doors, and maybe even to possibly your question you just said. But I do know the projects and things, and they can put as many on that roster as we can, and because this is part of the county or cities or whatever, we can help. We do that because we are actual members of that group. So I don't know, something to look into as a possible funding mechanism.
Hearing no other comments, we'll move on to public comments. Do we have any?
There are things.
Good, thank you very much. I will accept the motion for adjournment.
Second.
And seconded. All in favor? Aye. Have a great holiday season, everyone. We'll see you back in